One of the focuses, or the main focus, I should say, for the CPD year for this year is EDI and how it relates to our clinical practice. Now, in terms of EDI and the questions that we are asking, we've broken this down into two main sections. So the first one is thinking about your professional responsibilities with regards to EDI. How well do you feel you meet these in the assessment and care of your patients? And where do you think the gaps or the areas for improvement might be in your knowledge and its application? Now, EDI is a very, very broad term, but predominantly we have to find a starting point somewhere. And so I would urge you, when you're answering that question, to think about your patients who have multiple protected characteristics. That's often the easiest way to look at it, because it will give you a nice firm starting ground. So we all have protected characteristics, because age is one of them, gender is one of them, sexual orientation is one of them, religion is one of them. So we all have protected characteristics. However, some of our patients will share multiple protected characteristics, and there are what we term intersectional issues in terms of the care that we provide. So, for example, a patient who is profoundly deaf and who is in their late 70s and who perhaps has mobility issues as well, or is registered with a disability. So with these CPD questions, we are asking you to look at a patient like that as an example and say, how well or how competent do I feel if I were to be assessing that patient? And it's something that comes up time and time again. I see it in Facebook groups. It pops up all the time. Somebody will say, if I have a patient who is profoundly deaf, or if I have somebody who doesn't have English as a first language, am I responsible for getting in a translator? Do I have to provide somebody to come in and to be present as a chaperone in the treatment? These are the kind of things that we need to be thinking about as clinicians. And that's what we're hoping that you will reflect upon and share as part of your CPD for the year. So thinking about whether there are gaps in your knowledge when it comes to assessing a skin lesion in a patient who is from a minoritized ethnic group, so in black or brown skin, for example. It's something I know it wasn't covered when I was at university. And it's something that I think we need to be aware of. We're going to be seeing an increasingly more diverse patient base as a profession, as we should be, and if our EDI efforts pay off, which it looks like they are. But these are the things that we're encouraging you to think about. So the second question is thinking about areas for improvement in your ability to assess or provide care for patients with protected characteristics that are rarely encountered. How have you or will you address this to enable you to improve your practice during the CPD year? And how do you intend to ensure you maintain and develop your professional responsibilities in the context of EDI in future years? So an important part in that section is protected characteristics that are rarely encountered, because we see pregnant patients all the time. It's important, but it's something that we see. We see patients different ages all the time. So we need to think about those situations where, if you had, as I did when I was in my first year of practice, I had a patient who'd been knocked backwards off a bar stool and had been left paraplegic, and I didn't have the foggiest clue how I could get that patient on the bench, for example, or whether I was responsible for wheelchair accessibility in the clinic, or whether it was the responsibility of the building owner, these kind of things. So we are going to encounter these patients, and these are the type of situations that, unfortunately, if we aren't prepared or we don't have a plan in place, it's where we can be caught out. So it tends to be one of those situations where perhaps we don't worry about it until it's too late. So hopefully with these reflective practice questions, we're going to be taking a much more proactive approach and a much more inclusive approach for these patients to make sure that our clinics are already prepared, that we have a plan in place, that we have inclusive intake forms for people who've undergone gender affirmation surgery and things like that, or who use neopronouns, all of these things that we need to be thinking about. And it's the relevance of EDI to our clinical practice that is really, really important. So that's what we're looking for. There is no expectation for registrants to go out and undertake any form of official training course unless you think it would be helpful. There are courses out there. And I would always encourage people to undertake training in an area if you feel that it's an area where you would require more training, but there is no expectation that you would undergo any kind of formal training. This is reflective practice. And we're certainly not expecting you to go out and take some kind of official course to do this. So I hope that's provided a useful summary in terms of what we're looking for and how to get started with these, because it's often the thinking of how to get started with these questions that I know I used to struggle with. But I am always very, very happy to answer questions. I can't sit there and hold hands while you're doing your CPD submission, but I will very much be there with you in spirit. And if there is anything that comes up throughout the year and you want to check in, or you want some signposting towards resources or things like that, very, very happy to help and to provide that.